So today what we're going to talk about is how to minimize your chance of injury and therefore maximize your training. We want to avoid as many speed bumps in the process as possible. Otherwise, you're going to be restricted to where you want to go, right? Your goals are important, and the best way to achieve them is to have the smoothest training process possible. That's all we're going to talk about today, how we can make it as smooth as possible. I want to start off by saying, firstly, that I'm not a allied health professional. And if you do need to seek further advice, everything that I'm going to speak about today is just general, okay? So if you need to go above, please do so and not just take everything that I have as gospel. It's important that you do your own research as well and speak to the right person, okay? And I might even be able to give you a little bit of guidance of who you might like to speak to throughout the presentation. So, three main questions. We're going to go with what, who, how. What can you do to reduce your chance of injury? Two, who should you speak to if you do end up with an injury? And how can you go about managing a current injury? Okay, let's start with the first one. We want to reduce the chance. We want to reduce our risk of injury as often as possible because they suck. Simple as that. They suck and they're going to take us 2 steps back towards where we want to go. Main priorities here are understanding where you are at through a comprehensive movement assessment or screen and identifying what your training history is, okay? Once we have all that information, so we're gathering as much information as possible, we identify your risk at the current point that you're at and then decide what we can do ongoing. So we profile the risk profiling, and then we understand your load and how to manage that over time. So what load management is just how we're going to make it a little bit tougher or we're going to make it a little bit easier, right? Depending on where you are at and how much over time, okay? So we'll start with the first one. Your trainer would have already done this with you. A comprehensive movement screen, you would have done it in the initial assessment. If you haven't, ask your trainer to do it with you now, okay? In the initial assessment as well, you would have done a background of your injuries and limitations, your medical conditions, who you've trained with in the past, have you done group classes, yoga, whatever it is. Your trainer's collecting this information so that they can create the best idea of who you are at this point in time as possible through the exercises that they've prescribed you and through the things that you've done in the past, okay? They're doing this because they are trying to identify your risk at this point in time, right? There's a lot of things that go into it, and this Weber determinant on the left is what we can consider as gathering the information stage. So we're gathering as much information, we're identifying the risk profile, and then thinking to ourselves as a trainer, if I do X session, or if I tell them to go for a 2-kilometer run versus a 10-kilometer run, what is their chance of injury there? Because they're always thinking in the back of their head, I want to make sure that my client has a really good session. It's tough, they're working towards their goals, but that they don't get injured. They're firstly thinking, do no harm, okay? So when it comes to Weber determinants, we have to look at all the other risk factors that are involved. So your trainer's trying to get your age, your gender, your body composition. They're trying to get these details of your health history, any other physical fitness markers. So they fitness test you. They're getting a general idea of your skill level, like what sports have you played in the past? If we do something that's close to that sport or activity, are you at risk? Then are we gonna, once we've got the physical stuff and everything that's happened before, we have to think about what are you going to be doing ongoing as well. Okay, so what activities are you going to be involved in with us and etc., like outside of it as well. Okay, so we're taking the risk factors, we're putting them into our little methodical brain of ours, and then we're thinking, okay, cool, if something does happen, this is how it could go in our minds, right? And if we look at primary example here of a hamstring injury, these are a bunch of well-known risk factors for hamstring injury. So as a trainer, if someone's had a hamstring injury in the past, or they want to reduce their chance of having a hamstring injury, I need to think of these factors and involve them in my training. So this is why your trainer is getting as much information about you as possible. So I can put it all together in this profile. And then as the process goes, as training continues, they can manage your load by tailoring things up or down, okay? We want to make things, we want to stay in the sweet spot because that's where injury risk is low. And what we mean by the sweet spot is we're making it tough, but we're not sending you to do 1,000 burpees, right? When you've only ever done 10. We want you to push the limit of your ability because that's where the growth happens. That's where you're actually going to get better. And you need to be struggling those last couple of reps, but we're not going to run you into the ground because that's where injury risk occurs. Okay, that's that danger zone, right? So we understand why the thought process is there from a trainer's point of view in identifying and collecting as much information. What happens though? And who should you speak to once you do, or if you do get an injury, okay? Because there's so many allied health professionals. You have your doctor, your physio, your osteo, your chiro, your exercise physiologist. Who do you speak to? There's so many people out there, you don't know where to go. And that's fair because it's tough, right? The bottom line here, and I'll circle back to it in a second, we need to go to the person that realizes you are not your injury. Okay, so just remember that for a second because I'm going to come back to it in a couple of slides' time. So who should you go to? Doctor, physio, osteo, chiro, EP, who should you go to? At the end of the day, each of these practices will have their preferred method. Okay, what I mean by that is they like to do things almost like if you went to a Chinese restaurant, you kind of know what type of meals they're going to cook. If you went Italian, you kind of know what meals they're going to cook. Each of these professions are going to have their primary meals or their primary ways of practicing so that they're comfortable with, that they're really good at. And if you like these different meals or different practitioners, you should go to them, right? Because at the end of the day, if they're doing the best service by you, they're still going to get a good result. If we look at physio, for example, they're going to be a little bit of hands-on. They're really good with musculoskeletal, so muscles and bones. They will typically use a bit more massage than some others and then mix in a little bit of exercise. They might send you home to do some exercises. Osteo, again, maybe more holistic than the physio. So they've got a couple of other passive interventions, and I'll talk to you what that is in a second. But also musculoskeletal can help there. Chiro, very hands-on. If you enjoy that little bit of touch on you in terms of like it makes you feel comfortable, it makes you feel like there's an outcome happening, then that might be a good option. And they're typically associated with back and spinal, so vertebra or any soreness in their low back, neck, postural type of stuff. And they're very hands-on. Manipulations, cracking, you've seen those videos on Facebook and YouTube, right? And then what about an EP, exercise physiology? So they're exclusively hands-off. They're not going to be actually massaging or manipulating you there. They're still good with that musculoskeletal bones and muscles. And they might be able to help with more chronic disease, obesity, diabetes, stuff where they don't have to be as hands-on, okay? So when there's an injury or there's a ongoing issue, you need to be able to pick or at least speak to your doctor to help pick the right person for you. And why I've got doctor in the middle is because the doctor's really there to refer. They might just have some general advice, and some doctors might be really good with musculoskeletal. What I'm saying though is you're best off asking them for a referral. Doctors are like jack of all trades. Okay, they're not really a master of anything. They might be able to rule in or rule out some things in terms of an injury or an illness or something like that, but they're best served as a referral network. Okay, so ask them who they think you should go to. Okay, quickly on the passive interventions or active interventions. All of these physio, chiro, osteo, EP, they're all going to have different ways of trying to modulate your pain or try and reduce your pain or get you back to where you want to go. Passive interventions are things where you don't actually do anything, but they do the intervention on you. So it might be dry needling, it might be the cracking, it might be cupping, it might be massage, right? Active intervention are exercise. It's exercise. So It's like your little rehab exercises. It's fixing your posture with these exercises. It's suggesting you should do X, Y, Z because it's going to help you long term. The best practitioners will have a combination of both. Again, as I said before, I'm not here to tell you where to go, but if your doctor, physio, chiro, osteo, whoever it is, says only do passive, then you need to be a little bit more concerned about how they're approaching it. And why I say that is because it takes the onus out of your hands. You can't do anything by yourself. You can't do anything at home, the other sessions throughout the week or the other hours throughout the week if you're only receiving passive intervention. The passive stuff helps down-regulate the pain initially so we can push towards active intervention and you can take ownership of your injury and then you can progress past it and move on. Okay, you don't need to be continually going back to them because you need a tune-up. They should be trying to encourage you to do extra stuff outside of it so you essentially never have to see them again. Okay. So the other important thing to consider, and the main important point here is you need to go to a practitioner that realizes you are not your injury. And what I mean by that is if I hurt my hamstring, they still refer to me as Seaton. And it's not that they're going to remove your name from everything. They're not going to just write hamstring injury client or patient, but they need to know that you're a human. Your life is not this injury. You are not labeled by it. You have this injury and this injury will go. Okay. Because there are three, it is not only biological. So what I mean by that is if you have the injury, biologically, you have tissue damage, you have X, Y, Z. Okay. But there is also psychological factors associated with injury. Okay. You have lower feelings of motivation. You don't want to do your training. You don't want to do your exercise because everything hurts. You have it build into other parts of your life that are really tricky. And you're like, oh, my leg's sore, my back's sore, my neck's sore, and I'm having problems at home and work. And there's so many other variables on the psychological side. And then the social side, I don't want to go out because I've got this injury and I can't see my friends, I can't do this. If we look at it purely through biological lens and people would just say, you are the injury, they're the ones we want to avoid because we know in ourselves there's so many other factors, okay? And what I mean, and you can see here is the interaction between them all. We've got on the left, we've got the biological side where we've got the injury, okay? We have tissue damage. Yes, we have to do some sort of physical therapy to fix it. We've got to reduce the pain and function. But with that injury, we have our anxiety, we have our pain, we have anxiety, and we want to be able to reduce that anxiety and reduce the pain over time. When it comes to that social side, what can get influenced there? Where we're going to withdraw from training, or we have this perception of withdrawal from training if we can't do the things we used to do, okay? You need to understand that they're all related, and we need to find a way to avoid this loop, okay? Here is our injury in the middle. We've got our pain experience, something's sore, something's hurt, something's torn. If we identify ourselves as catastrophizing it, or our practitioner is catastrophizing it and saying this is the worst thing that could ever happen to you, we're going to have a fear of movement, right? Fear of movement means the tissue gets weaker over time and your risk goes up. If you think back to that risk profiling before, strength is not the only thing you should consider, but it is a massive variable in re-injury in the future, okay? If we have that fear of movement and re-injury and pain, we will be avoiding extra exercise, okay? That leads to that disability, that depression, that sadness, and then this cycle continues. The only way out into recovery is by identifying with the right practitioner, removing some of that pain experience, bring the fear down, confronting that fear, speaking to the right people, getting your exercises done, getting your passive and your active interventions done, and finding your way out. Don't want to be ending up in the cycle because it can be ongoing, it can be years, okay? The last thing, how do you go about managing a current injury? Big 2 points to finish it off. You need to be able to communicate with your current trainer and you need your current trainer and your primary healthcare practitioner, whoever you choose, osteo, chiro, whoever it is, they need to communicate. It needs to be symbiotic in that relationship. Otherwise, it's going to be a mess. Okay. After that, we need to be able to find ways to alter the training process with that relationship going on and continue, right? You don't want to stop. Maybe there are some instances where there needs to be a little or short break, but any good relationship with the trainer and the primary healthcare practitioner working together, there will be things you can do. Simple as that. Okay. So in terms of communication, can you get them to call? Can you get them to send an email? Can you just get them an opportunity to speak? Physio with trainer, your current trainer, and whoever you want to seek for that medical advice. Okay. I can almost guarantee you that your trainer will be so invested in your outcome that they want to speak to the physio, the chiro, the osteo, whoever it is. And if a good physio, chiro, osteo, whoever it is really taking care of you, then they will want the PT to communicate and help you in your sessions with the exercises they might provide externally. Okay. When it comes to altering the training process, it used to be RISA or RICE, if anyone remembers that one, when you have an injury straight away, you ISED, you rested, you put elevation, you put compression. Cool. This is an updated version of that. So yes, initially, acutely, if you have something hurts or you lean over and it hurts, you can protect it in the short term. Okay. You can elevate it. We want to try and avoid some sort of anti-inflammatories in the early stages because it masks what's going on. It can kind of blur and muddy the waters of understanding what's happening, especially if it's quite painful. And then we take that, for example, it's quite painful and there's no clear swelling or something like that on the injury. If it's painful and you can't see it, then we're blocking that pathway and we don't know what's actually happening. Compression, all fine and well to do. If you can compress the area, it will help minimize the swelling for that period of time. And then education. So it's the PEACE section where if you can do some things, as in walk, you can cycle, you can do anything you can do is good. Okay. And then once we've got through that initial acute stage, we move on to LOVE. So this is why I stressed before that the passive interventions are fine. That's their first P stage. But if we don't move to active interventions, then we're going to leave ourselves dry. Okay. We're going to leave ourselves going, okay, all well and good. I go and see my practitioner once a week or every second week, but I'm still not able to get back to what I wanted to do before. And if you want to get back to exercising, which I assume most of you would, otherwise you wouldn't be listening to this, from an injury, then you need to continue the training process. You need to load the specific area in a safe way. Let pain be a guide, but load it in a safe way. Be optimistic that you are not your injury and that you will continue on with this process. Can you also get your heart pumping, the blood pumping, move it around the body and circulate it? That increase in blood flow over time will help clean up and fix the tissues. And then just you exercising feels good. You know what it feels like when you finish an exercise, the endorphins are rushing and you feel great. That in itself is protective for future injury and is going to help the process. Okay. So just a quick summary. The question of what can you do to reduce your chance of injury? We have the 2 points of you need to identify where you're at with a comprehensive movement screen and training history from your trainer. They'll ask you the right questions. They will then help you identify their profile of risk of you. They might not say it directly. They're thinking about it in their mind. Is this person ready for skipping? Is this ready for a 2-kilometer time trial? Can they go back to doing plyometric activities yet? They're thinking about this based off their experience and where you are at. Who should you speak to if you do get injured? Doctor, physio, osteo, chiro, they're all going to have different skill sets. You need to pick it like a restaurant. You need to pick it what you enjoy and what you feel works for you and your body. But make sure that they don't identify you as a pure injury, and that they're mixing up passive and active interventions. When it comes to how to go about managing the current injury, if you do have one, get that communication pathway open. You, your trainer, and the allied health professional need to be communicating. Otherwise, it's going to be a mess and not get you to where you want to go. Okay. And then we need to continue the process. So you need to continue training. Otherwise, you're going to have a reduction in strength. You're going to have a reduction in all these type of mood and all these variables that are going to influence how you feel about the injury. Remember that biopsychosocial, the three kind of pillars there, they are all interrelated. If you stop training, your social goes down. If you stop training, then your psychological mindset goes down. If you stop training, the physical goes down as well. That's the biological. So it needs to continue. It's going to look different. For sure, your training will look different, but it needs to continue. Okay. Thank you all for coming, and I hope you picked up something important from today.